Welcome to this paediatric first aid presentation. This is the theory component where I will take you through the key elements of the syllabus required for EYFS. The thing to remember with this type of training is you can dip in and dip out as often as you like. Please don't just sit through this and say, yeah, I've understood everything. It's really important for you to come away and have a think about it and come back. You might choose to refer to your book. You may also choose to refer to the internet for additional information, so please remember that. Paperwork wise, just make sure once you've done all this that you fill in your statement of understanding, that you've done the theory session to ensure you're ready for your assessment. The assessment normally takes place during the practical session, whereby the trainer will have a chance to look at you, but also there'll be some paperwork involved as well. So you've got some sample questions within the website here just to help you along. You've got your course booklet, which is in electronic format. You do get a physical version, but that will be issued to you on the day. But with regards to the electronic version, which is on the website, what you should be doing is just keeping an eye on the top right corner of the slides when I'm doing the presentation, because that actually refers to the page in the book. And I think that's quite helpful. I obviously will not remember absolutely everything to say when I'm doing this, but a lot of the time you can simply just look at the page and that'll give you additional information. I'm also a great believer in self-directed study to get you thinking yourself. The internet now is a fantastic resource. You can basically ask anything on the internet and it'll give you the answer. We follow the guidelines laid down by the UK Resuscitation Council, by the Health and Safety Executive, and also by the Department of Education guidelines for EYFS. So what we provide is quite legislated. Therefore, the training you get should be pretty much content-wise, whether you train with us or somebody else. There may be slight variations depending on opinion, but the guidelines are very clear on what you should and shouldn't be doing during an emergency. Okay, so principles of first aid. We're going to look at the aims of what our priorities are. We're going to just touch on the law, and we're also going to look at accident recording, which is quite important. So, what is first aid? Well, we always look to see where we're getting the information from, and the First Aid Manual 2011 by Dorian Kindersley states that it's the immediate assistance or treatment given to a person who is injured or suddenly taken ill. So the three main priorities, we call them the 3 Ps, are to preserve life, to prevent the condition from worsening, and to promote the patient in its recovery. So we're going to look at the legal aspects now. The main document that we all work from is the Health and Safety at Work Act. That's 1974. Now, that is the base document that everything works around when it comes to first aid. However, on an interesting point, the actual design and syllabus for the early years first aid is not actually governed by the Health and Safety Executive. And a lot of people don't realise that. They have actually no input into that. Now that may be changing, or maybe it has changed, but as I talk about this, it's not the case. The syllabus originated from work with the Red Cross St John's and also the National Childminding Association, but the Department of Education now oversees what should be in the course. So we've got other documentation as well. We've got the Health and Safety First Aid Regulations 1981 and the Control of Substances Hazards to Health in 2002. That's basically how you manage your chemicals and things like that. In the settings that yourself are working in, possibly early year setting, school setting or home, yeah, it's just the management of household chemicals and such. We've also got what's called RIDOR, which is basically the reporting of injuries and diseases or any dangerous occurrences. The thing to remember is only if it's a serious situation that you're meant to report that. So within RIDOR, you must report serious occurrences, a major injury, an injury that's lasted more than 7 days, or if they've had to go to accident emergency. Now that's for members of the public. If it's an internal situation with a child at a setting, it doesn't actually have to be recorded. And anything that's a work-related disease, I'm not talking about if there's a child epidemic of measles or stuff like that. I'm talking about, you know, if there's something that's actually created a problem like asbestosis or something like that. If there's something that was a near miss, that should be discussed as well. That could be something like say structural failure in a property, which then resulted in people nearly being injured, something like that. You should have an accident book, and the accident book should be documented if anything is done or if anything happens to a child in your care. It's just good practice as a reference, and I'm sure most of you go down the road of using an accident book anyway. It's good to reflect back on what's happened, or if you see any regular incidents occurring, you can identify there could be something wrong with the building or something wrong with the activities that you're doing to create these problems. So the accident book should contain things like details of the casualty, the person who gave the care, what actually happened, and what treatment, if any, was required and given. What happened next? Were they sent home? Were they advised? I know, for example, within the early years setting that my children go to, they've got very strict rules on things like bumps to the head or high temperatures, and they will contact us pretty quick and we can make a decision based on what their guidance is. Anyway, so once the stuff's done, then all the information should be signed off by the first aider. Obviously the child can't sign it off, but the parent typically would when they arrive. It may also be worth taking images, if you feel that's appropriate, with the bruise to make sure that there's no any incident later on which you could be accused of being the same accident. There may be safeguarding issues on that, but again it's down to the individual setting to decide on the policy. First aid kits. There was a new standard that was brought out, BS 8599. It was published on the 30th of June 2011, around what should and shouldn't be in a first aid kit. So the general overview is that they should be easily identified, and that's the standard box that we've got. It's not required that it's a green box, but they're extremely cheap to get now. They're not an expensive thing. The contents are sealed and protected, so they can't be reused. It's very much one use and throw away. Obviously easily accessible. Everyone needs to know where they are, and it's got enough in there. So that's the thing to bear in mind. So that's the standard. You'll be surprised, however, what they require and what they don't require to be in there. So let's have a little look at that, and we're going to play a little game here just to see if we can work out whether we know what should or shouldn't be in there. Right, let's start with something. Oh, how about safety pins? What's your thoughts? Yeah, that can go in there. What about a cold pack? That's fine. First aid advice? Seems alright. What about a sweet drink, Lucozade? No. What about some dressings? That should be okay. Plasters? Absolutely fine. They're sealed. What about an eye wash? No, they shouldn't go in there. There's a reason for that. Use an eye wash, what happens? It's not sterile again, so you can't use it. Tough cut scissors, they're always handy. Micropore, and that's bandages, sealed. Triangular bandages, they're always handy. Tweezers, and if you think about it, yet again, the reasons why they don't go in there is because once you've used them, unless you're going to sterilise them again, and you can keep them sterilised and sealed, they're not safe. Gauze swab? Nope. Calpol? Absolutely not. As again, it's something that's frequently used with infants, but as soon as you've opened it, you're actually dealing with something which could be contaminated. Secondly, as well, it is a medication, and we don't give medication unless we're advised to by parents. Glucogel? No. Antiseptic wipes? That's fine. Foil blankets to keep somebody warm? Yeah. Burn treatment? That's fine. Pain relief? Shouldn't happen. Aspirin? Shouldn't happen. Cling film? That's really good for the treatment of burns, but that can't go in either, really, because it's, again, once it's opened, it's sealed. But they are really useful first aid things. I think what we're trying to look at here is that something like a drink is absolutely fine if it happens to be in the environment to help for, say, someone who's diabetic, having a very low period. But otherwise, it shouldn't be getting. Auto injector, that should be issued only to the individual. Eye wash, that could go in as long as it's sealed. Cotton wool balls. Latex gloves. That's interesting, because if you look here, latex gloves didn't go in, but vinyl gloves did. That could be, or maybe because of the issue of people who have a latex allergy. It might be worth researching that yourself. Sealed glucogel, that's another one that's a little bit we're unsure about, and the face shield, absolutely fine. So anyway, feel free to research that a little bit more, dig around, have a look in your own first aid kit, see what's in there. When I was delivering a lot all over the country, what I'd do is I'd go into a setting and say, can I see your first aid kit? And it's not so much now, but going back a few years, there was some things in there which was like, I mean, honestly, I couldn't believe it. I actually found one setting that had smelling salts in there from like 1952. I'm going back a few years now, but you'll be surprised what gets left around. So go into your first aid kit, see what's in there, and really everything should be sealed and dry, and there shouldn't be any really forms of liquids, treatments, ointments, nothing like that whatsoever. We're now going to start looking at the treatment of casualties, and the main priority is how we can get information on what's happened and how we can help them. The main form of communication is obviously verbal, and if you can get questions and answers moving, then it really helps the situation. So communication, it's very important to use their name. It's probably the most important word in anyone's vocabulary, and they'll respond to that quite quickly, and it's good to build up that rapport. Again, if you know the person you're taking care of, it's common sense, but if you do happen to be involved in a situation where you don't know who the person is, they'll ask that name straight away. If you look at any medical professional, that's the first thing they look for. Please assume that the person can actually hear you. Someone who may have a lowered levels of consciousness may look like they're sleeping or they're actually unconscious, but many people say they can hear things being discussed, so it's really important that you don't talk to them in the third person. It's important you communicate with them in an appropriate way. Tell them what you're doing if you are giving any care. Keep it simple, keep it really clear, and be honest. That's not to say that you would say something which could upset the casualty, but you know, when you're talking to them, tell them you're going to take care of them and tell them what's happening. Eye contact's very important, and obviously your body language is quite important as well. If you can imagine a child that's feeling very frightened, even if they know you, to suddenly be standing over them or to be very too close to them, that could cause them a little bit of anxiety. So what you want to do is make sure that you balance the need to care and not overstress them. Ample. If the patient can actually communicate with you, it's important that you can find out a medical history, and we use AMPLE as an acronym to give us the key information. So A is for allergies. You'd ask them if they have an allergy. M is medication. Do you take any medication? P is past illness or injury. Has something happened to you like this before? If they take any medication, L is last oral intake, if they do take any sort of medication that they take. And finally is the event history, what's actually happened. What you will find is, unless it's a trauma, an accident, someone's taken a tumble, there's a very high likelihood that if somebody's become unwell, they've got some historical background, and what you're trying to find out is what that is. Things don't typically happen just out of the blue if they become unwell. There is some kind of pre-incident indicator to tell you, and we would find out quite quickly by saying, have you got an allergy? Do you take any medication? What's happened to you before? Have you got any medical conditions? When did you last take your medicine? And finally, what's happened now? You're going to be stressed. It's really important that you try and slow the care down to ensure that they've got time to think and respond. Anyone that's been unwell or had any kind of injury, any sort of shock to their system, any anxiety, they're not going to be 100% with it. So you've got to give them a little bit of time to respond so they can have a think about what to say to you. Acting calmly and confidently is easier said than done. It's important for you when you're dealing with a situation to almost stop yourself for a second, take a deep breath and just see what you're looking at, and before you start getting involved, try and think about what the important priorities are, and we're going to talk about that very, very shortly. Special consideration when you're dealing with children. Speak to them gently, but be quite firm about what's happening and what you're doing. It's not the time to try and pander to their every need. You've got to get down to what the priority is of that patient care. If the child's talking, that's time for you to be quiet and listen to what's going on. Parents and caregivers can sometimes start to get involved in explaining to a medical professional, paramedic or a doctor about what's happened. The only person who could really tell them what's happened is the child, and it's important that you step back a little bit when it comes to any form of medical handover. Children do understand more than we credit. I'm constantly being reminded how well my 3-year-old daughter knows exactly what I'm talking about when she shouldn't. So we need to remember that and not to try and talk in code. Kids are very, very switched on these days. And as I said before, try not to be pandering to the drama. Think more about being empathetic, I would say, understanding that they're going through a lot of stress. So just try and bear that in mind. If you've got concerned friends, they've got concerned friends, agitated parents, a member of staff that's not coping very well, get them to go off and do something to get involved. It could be something ridiculous like, can you go make sure the kettle's boiled for a cup of tea? Can you go and fetch this? Can you go and find so-and-so? Worst case scenario, can you please go to the gate and make sure that the ambulance knows how to find us? Can you please stand at the door to make sure they can get through security? These things are all really useful, and that agitated person who's quite concerned is far more used to you being elsewhere than standing watching over whatever's happening. Safeguarding issues, and also any issues with regards to incompetent first aid. It's very, very, very rare, but it's always worth having a witness. I would say mainly on the safeguarding issue, to ensure that you've got backup on what treatment you gave. Many, many years ago, when I was giving first aid, I remember there was a potential safeguarding issue. It was very straightforward. We had an accident in the swimming pool and I was pulled in to help to give first aid, and the child was completely covered in blood. I mean, it was everywhere, and I just felt that we needed to clean her up as well as deal with the wound. And as I was cleaning her up, I thought, hang on, I need a witness here. So I went and got a colleague to witness me cleaning the blood off her arms and legs, just to be on the safe side. And it's just, when you're giving care, you forget sometimes, but it's important, just think, just really, really think about safeguarding issues as well. We need to think about the aftermath. Okay, we'll start to look at emergency actions, or we call it action on emergency. And the two main issues are how we actually activate the emergency services because it's serious enough, and how we do what we call the primary survey to see what the response levels are of the patient and if they are conscious, breathing, and the extent of the injuries. So making the call, it's very important that you identify exactly where you are, easy landmarks, to ensure that the emergency services can get to you quickly. They will ask you details on what's happened, the age, the extent of the injuries. They will ask you if you require other support. It could be police if there's some criminal activity, or possibly fire brigade if somebody's got stuck, or if there's any damage to a building or a vehicle or something like that. Number of casualties, and they will ask, who's slightly injured and who's more seriously injured. That again will determine how much is dispatched towards you. And they will ask you questions on breathing and such issues like, have they been knocked unconscious and things like that. Always give the location again, because no matter what information they've got, they need to get to you. If they can get to you quickly, that's really what it's all about. This information that you give will probably be extracted by professional call handlers, and they work on a system called criteria-based dispatch. Essentially, they have to prioritise who gets the treatment first. And if you can imagine, there could be two things happening in the same area once at the same time, and they've got to decide, you know, okay, we will send the car to that facility, or we'll send the ambulance, or we'll send the ambulance police bike, or we'll send a helicopter. They've got to work all that out. So just make sure you give all the information as clearly and as honestly as possible. Okay, so we're now going to go into the primary survey. You will be practicing this on the day, but this is just going to give you a little overview. You'll probably recap it again on the practical session, but what we're going to look at now is a little video which is on your website from the British Heart Foundation, and that is essentially the primary survey and the recovery position. It can be used for children of any age.